to share with you all today about the Eclip platform. Let me share my screen here. All right. Are you all seeing the correct view? Anyone want to confirm? I'm not showing my presenter screen.
Yeah, it looks good.
Great. Okay, excellent. So I'll save time at the end for questions, but we have a nice small group. So please, at any point, feel free to just jump in. I am not awesome at multitasking, so if you put questions in the chat, I can get to those in the end. But if you have kind of brief clarifications you would like, please just jump in. So today I want to talk about the Eclip platform, or Ensuring Quality and Psychological Support, which was jointly developed by the World Health Organization and UNICEF, and myself and collaborators at George Washington University were the lead scientific advisors in this process. And it's based on work and competency assessment that I'll describe in a moment that I had done prior to the development of the Eclip platform. It's a huge team of folks at UNICEF and WHO. Won't thank all of them here, but just wanted to point out it's a big collaborative effort. And the majority of the work that you'll see described today is funded by USAID. So as many of you in the call on the webinar today are aware of, there's been massive expansion in the past 10 to 15 years in trainings and psychological interventions around the world. A number that Teresa and colleagues that you all work with have led, as well as increasing proliferation from WHO manuals, and also a lot of locally developed forms of training and intervention as well. So it's super exciting to see this growth. And when we think about the process, there's really basically 4 steps to make this type of task sharing, task shifting, and psychological intervention successful. We need to select the right providers. We need to make sure that they get the appropriate training and practice. That then there's ongoing supervision, that's really vital. And then if all goes well, we assume we're going to get good client outcomes as a result of that. Now, many of us work, initially in the research space, so that when we do these types of task sharing, task shifting, psychological interventions, there's a lot of attention to how well that intervention is being delivered. And there often are a number of tools, highly skilled experts in terms of supervisors, research teams that are also attending to the process. However, when we get to the implementation space, when there's kind of that scale up in the real world, a lot of pieces may be different. So the coverage and cost in terms of feasibility might change. But in terms of quality of care, we may find that adherence to the intervention changes. We may also find that the competence of providers is different. And that's really what I want to emphasize and dig deep on today, is when we think about competence, how do we assure that we get the transition from the research space into the implementation space, that people are able to deliver these interventions safely and effectively. So if we break down the ways that this happens, we have the selection, the training, the supervision, and then ultimately delivery of care. And when we think about competence, there are really kind of 2 key opportunities to assess competence. One is during training, and then the other is during supervision. However, thinking back to how the field has operated over the past 10 to 15 years, we really haven't had consistent, systematic ways to do this. Often there are very talented trainers or supervisors who are thinking about the skills of their trainees, but in other settings that may not be the case, especially when the interventions are done outside of research settings. Now, when I say competence, what do I mean? So competence is defined as demonstrable skills in controlled settings. So it's not simply the knowledge someone has about delivering an intervention, but it really is their ability to demonstrate doing that, demonstrating the skills of cognitive behavioral therapy, demonstrating the skills of continuous processing therapy or interpersonal therapy, or even just demonstrating the common factors that are universal across all of these interventions, such as being empathetic, being a good listener, having good verbal and nonverbal communication skills. So competence is really helpful to think about because it is a structured way of assessing something. Often when we assess in the real world, in terms of when actual sessions are being delivered, there's tremendous variability that clients may have greater or lesser needs. They may have different types of challenges, the setting where that's being delivered. It is often hard to make judgments about how well someone can deliver care only by watching them do real world settings. So competence is often based on a more structured and systematic way, typically using role plays. So if we think about this, there's often informal use of role plays in the context of training, often informal role plays during supervision. But the idea here is, could we shift the field to kind of more systematically be assessing competence across different interventions and contexts? So a while ago, I think this work started around like 2013, working with Vikram Patel, Mark Jordans, and other colleagues, we began this journey around thinking about how could we assess competence? How could we develop a tool that would be something we could use to watch role plays of non-specialists around the world, regardless of the intervention, regardless of the language of the context, but something that would be something consistent across them. So we did a systematic review and repeatedly kind of boiled down, got to a tool of about 18 items and demonstrated the feasibility of using that in the context of Nepal. Here's just a snapshot of what this tool looked like a few years ago. It looks much different now, and I'll show you that in a minute. But the tool is referred to as ENACT, or Enhancing Assessment of Common Therapeutic Factors. So once we developed it, we used it quite widely with our work in Nepal, also at that time with projects in Liberia, Uganda, had some colleagues in Pakistan and other settings began to apply this. But then around 2017, 2018, the World Health Organization approached myself and my colleagues and said, you know, this tool looks really great. We're promoting all of these interventions. At that point, PM Plus was being scaled up. A lot of people had taken on the Thinking Healthy program and interpersonal therapy. And WHO said, well, what if we could imagine basically, you know, a universal tool that folks could use, and ideally a digital one, that could be used across any setting around the world? How could we scale up ENACT? And that began the journey for the creation of the Eclip Platform, which is now freely available through WHO and UNICEF. So this began in May 2018 with a Theory of Change workshop held in Geneva, bringing together a range of experts, probably many of some of your colleagues, to think about what would competency assessments look like in the context of trainings around the world, and would there be kind of additional resources beyond just the assessment tools that one would need to really shift the field from kind of a knowledge-based outcomes to really competency-based trainings. After doing that and developing kind of our theoretical model, we then held a workshop a couple of months later here in DC at PAHO, and brought together more experts to think about what would be those things across any of the existing interventions, Friendship Bench, CETA, IPT, PM Plus, that would be relevant so that we didn't have to have, you know, a separate tool for every single piece, but could identify some of the common elements or common practices. And so we through the workshop and then through additional reviews, refined our common factors, as well as developed a set of more treatment-specific modalities, but really those that cut across. So if there were aspects of behavioral activation that were part of Friendship Bench, but also part of Problem Management Plus, also part of the Healthy Activity program, then making sure that we could assess those in a similar way. The next step then was to pilot this approach across settings and across interventions. So the idea was, we don't want one treatment specific tool out there, but really strategies that could be used in diverse settings. So we tried out the very early versions of the Eclip platform in Peru with the Thinking Healthy program, in Lebanon with EASE, which is focused on adolescent mental health, in a number of settings, Ethiopia, Jordan, Nepal, and actually eventually in New York as well with Problem Management Plus. We did it in Uganda with IPT, which had been used there for quite some time. With colleagues from University of Washington, we looked at TFCBT, also focused on adolescents in Kenya. And then, of course, the CETA program, doing that in Zambia. And so this is where we ended up, and this is where I want to spend the majority of the talk today, is to show you what the Eclip platform is, with the hopes that that might be something that could fill a gap in your own research or practice in global mental health. So let me first show you just a quick video. It's an overview of it, and then I'll go into some of the specifics of the platform. Let me make sure I get the audio right. Okay.
Globally, close to 1 billion people are living with a mental health condition. In emergency contexts, the needs may be even greater, with 1 in 5 people exposed to war or political violence likely to experience a mental health condition. Yet most people around the world do not have access to adequate mental health care. Fortunately, evidence-based and effective mental health and psychosocial interventions are available that can help treat and prevent many mental health conditions, including in low and middle-income countries.
Sorry to interrupt. We don't.
These can be delivered successfully by people who.
But we have the correct audio.
Okay, thanks for letting me know. Let me fix that then. Hold on 1 second. Do you see the video screen now, or is it still a PowerPoint?
We see the video.
Okay, great.
Globally, close to 1 billion people are living with a mental health condition. In emergency contexts, the needs may be even greater, with 1 in 5 people exposed to war or political violence likely to experience a mental health condition. Yet most people around the world do not have access to adequate mental health care. Fortunately, evidence-based and effective mental health and psychosocial interventions are available that can help treat and prevent many mental health conditions, including in low and middle-income countries. These can be delivered successfully by people who have received training and supervision but are not mental health specialists. Ensuring high-quality and effective training and supervision is key to the safe delivery of these interventions. This is why the World Health Organization and UNICEF developed Eclip. Eclip stands for Ensuring Quality in Psychological Support. Eclip is a freely available resource to guide trainers and supervisors on how to change their existing programs into competency-based approaches. A competency-based approach means that helpers not only have the knowledge, but also the skills needed to deliver quality services. Eclip can be used alongside any type of mental health training or supervision and supports the use of role plays and real-world assessment of helpers. Eclip offers a range of tools to assess different types of competencies. This includes tools for working with adults, children, adolescents, and groups, as well as specific skills for psychological interventions. Eclip makes it easy to track changes in skills during and after training. After evaluating trainees on each skill, the platform automatically displays feedback to identify strengths and any potentially unhelpful behaviors for which further training is required. Research conducted on Eclip showed that when compared to standard training approaches, trainees in Eclip-based programs were more likely to reduce harmful behaviors and strengthen helping skills. For example, use of Eclip in Lebanon with children and adolescents led to an increase in mastery of core helping skills compared to standard training approaches. Trainings in Peru and other countries have shown similar benefits. How can you get started using Eclip today? Register online to receive assessment tools, resources for adapting training and supervision, and easy-to-use visual summaries for competency-based feedback, all free of charge. Eclip will enhance your trainings and supervision and help you and your team to build safe, effective, and high-quality services. Get started today at equipcompetency.org.
Okay, well, this is working. I was going to show another video later, but I think I'll just show it now while this is still working and not have to jump in. So this video is another short, just 2 minutes, 40-second video of applying Eclip with the Thinking Healthy program in Peru by Socios en Salud.
Trabajar juntos, contigo y por ti, ha sido siempre uno de los pilares de nuestro equipo. Por ello, cada día usamos nuevas herramientas y plataformas de aprendizaje que nos permiten optimizar los resultados y de esta forma llegar a las poblaciones vulnerables cuya salud mental es afectada. En este contexto surge el proyecto Eclip, una plataforma digital de entrenamiento que a través de un modelo práctico y eficaz fortalece las habilidades de los profesionales especializados y no especializados en la prestación de servicios de salud mental, específicamente en mujeres gestantes de la zona norte de Lima metropolitana.
Tener a la plataforma Eclip en nuestra intervención ha sido de gran beneficio para mejorar el entrenamiento a proveedores no especializados, es decir, agentes comunitarios de salud y proveedores especializados en salud mental. Asimismo, fue de gran utilidad el hecho de que se implemente durante las atenciones en la comunidad.
Profesionales especializados entrenan virtualmente a las agentes comunitarias de salud usando la plataforma Eclip. Una vez culminado el entrenamiento, las agentes comunitarias de salud son evaluadas y acompañadas en el uso de las habilidades aprendidas durante las sesiones con las gestantes.
Con Eclip podemos seguir el progreso del participante y realizar feedback en el momento que más lo necesiten y en tiempo real. Esto ha sido de gran ayuda durante la implementación del proyecto.
La experiencia en el uso de la plataforma Eclip demuestra que su implementación incrementa la calidad de los servicios prestados por parte de las agentes comunitarias de salud. Por otro lado, considerando que el cuidado integral de la salud mental materna es importante, se procura establecer espacios que vinculen a las comunidades con los establecimientos de salud u otras instituciones de apoyo.
Por este motivo, se espera que la plataforma Eclip escale a las instituciones públicas y privadas. De esta manera garantizamos que esta plataforma llegue a organizaciones que brinden atención a las personas que necesitan una atención en salud mental. Socios en Salud pretende establecer alianzas con el Ministerio de Salud y otras ONG para que se implemente a nivel nacional y ser un país referente a nivel de Latinoamérica.
Continuamos trabajando para brindar atención de calidad en salud mental.
All right, thank you. Your patience with the technical issues, and let me get back to the slides now. Okay, everybody seeing the slides again?
It's in presenter view.
All right. Now good?
Perfect.
Okay, great. All right, so what I've then wanted to go through in a little bit more detail is what the platform looks like and how you can all use it. So anyone can go to this website, equipcompetency.org, register. It's all free of charge, and then go through it and try to use it in any of your research or programs. It contains two main areas. So one is a series of courses about developing and implementing a competency-based training. And then the other section are the assessment tools, which you got a snapshot of just a moment ago. So the courses can be very helpful to prepare training on how to do a structured role play. There are example role plays available on the platform, but you can also adapt them. So for example, we have kind of generic role plays about people in distress, some about kind of COVID situations, some role plays that are more tailored to IPT or PM+, but really it can be used with any role play that you choose to create. Then the second component is the competency assessment tool themselves. And so this, you can register all of your trainees or if your research participants in here and then record the information for them at as many junctures as you would like: pre-training, post-training, post-supervision, additional follow-up. And what you'll see here is that the structure is really designed in a way that's not simply a Likert scale. And this was one of the things that came up in our development of the tools, was that often something like just a level 1, 2, 3, 4, 5, 6, it can be very difficult for a trainer or a supervisor to provide tailored feedback. But if we capture specific behaviors, it's much easier to be able to identify what behaviors you want to reduce or to focus on what behaviors need to be strengthened. And so for every competency, there is this 4-level structure that has you not only check off the level, but also the relevant attributes. The really helpful aspect of this that we found from all of our field trials is that very rarely do people do everything bad or everything correctly. They do some unhelpful or potentially harmful behaviors, but they also might do a series, some of the basic or even advanced skills. So this platform allows you to capture both of those and again, provide feedback that emphasizes the strengths and then helps to reduce any potentially unhelpful or harmful behaviors. And what you'll find is that there's a course that goes along with this that guides people on how to use the different types of competency assessment tools. As you saw in the video, there's currently a whole range of different tools that are available. For the foundational skills or the common factors, there's the ENACT, which is the one developed for adults, but then also a child and adolescent version, which is the WEACT, and then one that's specifically group facilitation skills. And again, this is agnostic to any particular intervention. So it could be used for group IPT or group PM+, or other types of group-based interventions. There's a couple, really just 2 at the moment, Problem Management Plus and THP, that are intervention specific. But then we've broken it down by the different treatment-specific strategies. So if you have an intervention that includes some CBT and behavioral activation, you could check both of those, or maybe it's CBT plus problem-solving techniques. So you can put together those treatment-specific competencies that are relevant for the intervention that you're delivering. The next component is that it walks through the different types of role plays that could be used and the different times when they could be used to strengthen your trainings. And so it teaches trainers and supervisors ways to do these role plays in a more structured way than they typically would have been done. There are more advanced aspects of the courses in there. For example, if you wanted to use this for a research evaluation, information on things like inter-rater reliability. If you were going to use this for a research study, you'd want to be sure that if you had multiple raters, they were doing it consistently. In just kind of day-to-day practice, putting all the effort in to achieve inter-rater reliability may not be as fruitful, but it is quite important when using this in the context of research studies. As you saw in the video, there's then this feedback that a trainer or supervisor gets. And what's really helpful is that it can help a trainer or supervisor identify those trainees who are struggling the most. Who are those trainees who are having the most level 1, those unhelpful or potentially harmful behaviors? And then also it helps a trainer or supervisor identify what competencies are really the most difficult for your trainees. Often that's assessing suicidality, so assessing harm and developing a safety plan, but there could be a host of other ones, and that may vary from training to training. So this platform is really helpful to determine for that particular training where are folks struggling the most, and then modify your training or supervision accordingly. And one of the things that we learned was that because many organizations don't take a competency-based approach, even though we were giving these results in terms of level 1 scores or level 1 trainees, that often trainers and supervisors weren't sure how to use that in giving feedback. So there's also guidance then on how I'm using different strategies to give feedback. And then also the difference between feedback when you're trying to reduce a harmful or unhelpful behavior, kind of a de-implementation strategy, or the feedback you want to use when promoting or strengthening positive skills and behaviors. So when we think about it, this tool, this platform can be used in many different ways. One of the things we explored was if trainers and supervisors had access to this information along the way, would it improve the overall competency outcomes at the end of training? So we found that in many sites, it was easiest to start out by doing this in supervision. You may not have a training coming up in the next couple of months, but you may have some supervision ongoing. So what you could do is try out the platform in the context of supervision to identify where people are lacking skills and then focus on improving those. Another area, once you have upcoming trainings, is to use the platform throughout trainings and just assess a few competencies at a time to see how people are progressing along, where they're struggling, and then where you might need to spend more time in the final days of the training to get people at a little bit higher levels of competency. One of the most advanced usages, but also takes a little bit of time, is actually doing role plays at the very beginning of training with all your trainees. And this can be really helpful to get a sense of what skills are they coming into the training with. Do they already have good verbal and nonverbal communication skills? Are they already good at, say, maybe some problem solving or brainstorming? That tells you you don't need to spend as much time in the training on that, and you could focus on those areas where they're weaker. So we have guidance if you want to do pre-training assessments on how to then adapt your curricula. So as you saw in the video as well, we've done some evaluations to see differences in outcomes. And what we found pretty consistently was that if you compared a standard training in terms of the improvement in competencies pre and post training, these are usually 5, 10-day to 2-week trainings, that often there was some improvement in the intended skills. But when the trainers and supervisors were really tracking this closely using the platform, we saw substantially greater levels of improvement. We also found that this could be used to track the negative or unhelpful behaviors, the harmful behaviors. And we found particularly in Nepal, but also in Peru, that when using the platform, there was a substantially greater reduction in these potentially harmful behaviors. This would have been the Peru video, but you already saw that. So I just want to give a couple examples of how we've also used this in the context of research strategies. So one option is that you can compare different training and supervision approaches to see the differences in competency outcomes. So what we've done in Nepal is using a technique to collaborate with people that live with mental illness to tell their stories through photographic narratives with a process called photo voice. And what we did was we compared a standard MH-GAP training to an MH-GAP training that included service users co-facilitating components of the training. And then we evaluated these outcomes using the platform with the ENACT-based role plays. And what we were able to show was that with the ENACT assessments, there was greater accuracy of detecting depression and psychosis among those individuals who had the collaborative MH-GAP training with people with lived experience, and that the ENACT role plays also predicted then their actual clinical behavior with patients going forward. We're now expanding the use of the Eclip platform in a larger cluster randomized controlled trial of that strategy in Nepal, and then also piloting the Eclip platform for similar collaborative strategies to training in Tunisia, 2 sites in China, 2 sites in India, Ethiopia, and another site in Nepal. We're also now trying out Eclip in the context of US-based trainings. So I know that Teresa has, and I mean, many of your other colleagues as well, always thinking about how we can apply the global mental health experiences and strategies to domestic settings. And this is especially important in terms of the racial and ethnic disparities in the US, which have only become further highlighted as a result of COVID. For example, if we think about availability of specialists, only about 1 out of every 10 mental health specialists comes from a racialized or ethnic minority background. And if we look in terms of current clinical services, this plays out in terms of very poor detection, that for every white patient with depression detected, only about half of patients of a Hispanic or Latinx background or African American background are identified, and only 1/3 of Asian Americans. So what we're doing in New York City is we're taking Problem Management Plus and modifying that for Black and Brown New Yorkers and evaluating skills using the Eclip platform. So we've taken what we've done with a very rural Nepal approach, and then in the context of COVID, we digitized this and made it into a synchronous, remotely delivered therapy over Zoom or WhatsApp or Skype or FaceTime, and are training members of community-based organizations in New York City to be able to deliver Problem Management Plus. This is part of an NIH-sponsored R01 called Recoup, or Restoring Mental Health After COVID-19 through Community-Based Psychological Services in New York City, in partnership with a whole host of community-based organizations in the city. So although we've had quite positive feedback from members of community-based organizations who didn't have prior training in mental health when they went through the PM Plus training and were delivering it, one quote really captures this. An individual said, "People who are unlettered have been taking care of each other throughout time. The clinician is not the lead here. It's the person who has the concern, an important shift in paradigm." But we've also identified a lot of challenges, which won't be a surprise to many of you. But often, despite good global data and good initial outcomes in New York City, we still find that many mental health professionals are concerned that someone who is not a psychologist, not an LCSW, not a psychiatrist, don't have the competency. There's concern amongst the non-specialists, those that are part of the community-based organizations, about whether or not this will lead to certification in some way. And then there are community health workers and other growing cadres of workers who want to know, like, is this part of our core competencies? So this is where Eclip is playing an important role for us to be able to demonstrate to mental health professionals, professional organizations, that we're achieving the necessary levels of effectiveness and safety. And this also provides a path to certification and establishing these minimum competencies. I want to bring up one other point before we talk a little bit about analysis of competency. And this is around the issue of selection. Now, for those of us working in global mental health, often we don't have a choice with selection. The government will say, train all our community health volunteers or all our primary care workers, or an NGO might say, we're going to train all the teachers in this community or in this village. However, when we do have an opportunity to select who gets a psychological intervention training, something like the Eclip platform can be quite useful. We recently did an analysis of what skills at baseline predict the later acquisition and achieving full competency for delivery of psychological interventions. And we found that it really boils down to 4 competencies. That if you assess going into a training, verbal and nonverbal communication, the ability to do some basic rapport building and some basic empathy, warmth, and genuineness, that individuals that score highly on those 4 competencies alone prior to a training, that predicts who is going to have the highest levels of competency after the training, not just in those 4 competencies, but also in the whole host of competencies required for delivery. So going forward, in situations where only subset of individuals might get selected to deliver an intervention, this could be a more effective way to determine who would be the best candidates for the training. And just some final comments on analysis. As we hopefully get more and more data on competency, have structured tools like the INACT, WEACT, Group ACT, and some of the other treatment-specific ones that can be used across studies, we really need to reflect upon how we then compare competency with client outcomes. And we did a review about 2 years ago to just show that the field is quite a mess in terms of this area. And part of it is that often we've had quite an overly simplistic approach of kind of a correlational analysis, the idea that, oh, as competency goes up, then client outcomes go up. But it's probably much more of a threshold effect, that once you reach kind of a moderate level of competency, you're probably good enough to deliver the intervention. And then there's other client factors or contextual factors that likely influence the outcomes. But one of the things is generating more data on competency to maybe identify these threshold levels rather than trying to use a crude continuous score to make assumptions that there's a dose response process that likely isn't the case. The next is maybe moving more towards moderation analyses around in our clinical trials to again think about competency as a threshold property, such that we can break down when we're seeing some individuals benefiting from an intervention but not others, that competency might moderate that association. And this is really important for those of you applying for future NIH grants, that is really pushed for much more on mechanisms of action, mediation, and moderation in clinical trials. So the opportunity to look at competency as a moderator is an area for greater exploration in the future. And as I was mentioning about NIH trial guidance, thinking about other ways to look at competency as a mediator. So thinking again about some of these threshold levels and how the greater levels of competency may predict client outcomes. This is especially helpful when you're comparing different types of training or supervision strategies, such as we found in the context of Nepal, where the improvement in competency led to greater diagnosis. And we're now in our upcoming trial going to look at not just diagnosis, but client outcomes as well. And then finally, competency isn't ultimately what a client experiences. A client experiences therapist quality, which is what happens in that actual session. So can we get quality measures from actual sessions, as well as the competency attributes of the individual provider, therapist, non-specialist, to be able to provide more detailed models and get a better sense of what the most important predictors are of client outcomes in the future to better design our trainings, supervision, and implementation strategies. So this is very much a work in progress, and it's a tool and a platform for everyone to use, give us feedback, and we hope to really continue to evolve the platform going forward. In no way is this a sealed and done product by any means. We really hope that in the future we can add in additional suites of competency assessment tools. Are there types of competencies not currently covered that individuals want to add? We'd be delighted to discuss that. As I was just discussing in terms of client outcomes, we need better work on establishing benchmarks. Although the platform provides the resources to be able to assess competency, we really don't have good data yet to say what is the minimum absolute kind of safe level for delivery. We need more research on that going forward. And then also we need more resources associated with the competency-based approach. What are the best competency-based training strategies? What are the most feasible strategies to be done in low resource settings? What are the strategies that can be applied to expanding use of task sharing and task shifting in the US and other high income countries? and other types of guidance from increased use of the platform. So that's it. So here's my contact information, and as well as our lab website. And I'd be delighted to take the remainder of the time and ask questions. Happy to demo more of the platform if that's at all helpful, whatever you all would like.